Bring you here now, the COVID-19, or if COVID-19 spreads, I should say, uncontrollably through South Africa, the public healthcare system, we've been told, simply will not be able to meet demand. Well, this has again been re-emphasized during a webinar hosted by the Actuarial Society of South Africa. Our reporter, Michael Appel, has been following that higher grade conversation. He joins me now in studio to make sense of it in hopefully much more plain language, Michael. So what more was actually said at the webinar?
A lot of maths. So yeah, let's sift through it. So basically the question has always been, what was the main purpose of the hard lockdown level 5? And it was to buy us time so that we could spread the amount of infections over a longer period, giving the healthcare system more time to build up capacity such as beds, ventilators, ICU beds, high care beds, etc. So this is what Barry Childs from the Actuarial Society of South Africa had to say about the roughly 120,000 beds that South Africa has. Listen in.
So private sector total just over 40,000 beds, public sector around 85,000 beds, so over 120,000 beds overall. But when you look at it per capita, obviously, because those two sectors serve different markets, and I'm using it very loosely here. Obviously, there are non-medical scheme patients that go to the private sector, etc. But broadly speaking, you have about a 2.8 times difference in beds per capita between the public and private sector. But for ICUs, that's about a 25 times difference. And that's the great concern from an equity and access to care point of view.
Speak more then, Michael, to the hospital admissions aspect of some of that presentation today. Was much of it new?
Yes, so they're working on data from April and May, which is pretty close, and private hospital admissions down 54% in April and down 40% in May. And this is obviously related to restrictions on transport. If you have a niggling cough where you may have gone to a clinic before, South Africans simply weren't doing it, and that's borne out in the figures. And that has resulted in specifically looking at something like tuberculosis in South Africa, diagnosis around that, how that has sort of faded away. People haven't been going to get their medication. Once again, Barry Childs touches on this. Listen in.
Lots of reports around TB diagnosis significantly dropping. Some reports around patients not picking up their medication, etc., particularly around the public sector. So that's not about the facilities and the availability of medicines per se, but when you have limitations on transport, that has a knock-on effect on people being able to access medication and core services.
And just on that, Michael, there's also been an interesting shift or change, if you will, in some of the medical reasons that people present with at various hospitals and clinics this year compared to the same period in 2019. How has that changed?
So once again, it's obviously linked to a complete change in behavior from South Africans not going to present at hospitals or clinics. So something like pneumonia, for example, which Barry Childs is going to touch on again, he says strangely that since this pandemic hit South Africa in particular, pneumonia cases have been almost destroyed, wiped out completely. And of course, the question which he leaves us with is people are still getting pneumonia, except they're not going to a hospital. So what exactly, where are these patients then going to get treated? Lastly, listen in.
What's been a bit of a surprise is the type of admissions that we've seen. So for all intents and purposes, COVID has wiped out pneumonia. Normally we're seeing at this time of the year that there's a fairly significant admission probability for pneumonia. And admissions for respiratory disorders are way down. Less so for some admission types like obstetric procedures. We're seeing eye procedures coming back now. But there's just a broad range, a much wider range than we thought, of admissions that have disappeared. And the question is, where have all of these hospital admissions gone?
So you've got all of these numbers that present very interesting scenarios, but where does the data go from here?
So the Actuarial Society of South Africa came up with its own model. They then present that to government, to policymakers. So actuaries take all the numbers, take all the statistics, build models to look at potential fatality or mortality models, infection rates, And I've done stories on that in the past. And then they take it to policymakers and say, these are the number of people coming in through the doors. This is how much, on average, 150,000 Rand to treat a person for COVID-19. This is how much budget you need in the public healthcare system. This is how you should be adjusting your policies. Hopefully the right people are getting the information.
ANC reporter Michael Appel, thank you very much for that.